after seeing this gathering, I know what Prime Minister Modi must have felt when he said 400 par and he got 240. Okay, but nevertheless, we have to do something about it. So we are going to make this session extremely interesting for you, and you're going to tell all the people, okay, sorry, you should have been there. Okay. Now this is something which we need to be familiar with. Cancer surgery is actually the same what it was about 70 years back, and we do the same thing over and over and over again and expect a different result. Albert Einstein called this insanity. The future of surgery is no surgery. And so the future of surgery is no surgery. Whether you like it, you don't like it, you want to be part of it, you don't want to be part of it, patients don't care. If you have seen in the last 1 year, you may have attended huge number of conferences, lectures like us, and everything is moving towards either minimal invasive or gastroenterology based GI surgery. Everything, these are all samples of no surgery. Nobody wants a scar, nobody wants a very prolonged stay, and everybody wants a beautiful result even after that. So the age of big surgeons, big incisions, I'm sorry, it's going out. Now, when we consider cancer, I'm just going to take you very fast through a little bit of technicality here. This is a Gompertz curve. Basically, what this Gompertz curve means that the early stages development is very fast. 2 का 4, 4 का 8, 8 का 16, 16 का 32. But in stage 4, the growth slows down. So therefore, many times when patients say, हमको डॉक्टर ने बोला था कि 2 महीना है, पर मेरा पेशेंट तो almost 8 महीने जिया. It's possible because he was in stage 4. Because then it's little bit unpredictable. You cannot predict the growth of the tumor in stage 4 because it is linear rather than it is 2 plus 1, then 3 plus 1, 4 plus 1, that sort of thing. So this is what is called the exponential growth. Okay, after that it comes to, this is a Gompertz curve. This is the exponential growth which is at 2 का 4, 4 का 8, that sort of thing. In Gompertz curve is S-shaped curve. So what it means is that from 0 to 30 doublets, 10⁹ cell on tumor of 1 centimeter, it takes a certain amount of time. But from 30 doublets to 40 doublets, because the tumor should be just about 12.4 centimeters, it takes almost 1/3 the time. So in stage 4, from let's say stage 2 to stage 4, the time periods are variable according to the tumor. Time period in breast cancer is from 1 cm to 1 centimeter is about 5 to 10 years. It is just 2 to 3 months in oral cancer. So if you have a start of oral cancer to about 1 centimeter or so, it may be just 1 month, 2 months. But for a breast cancer, it can be about anywhere around 5 to 10 years. This from 1 centimeter to a 10 centimeter tumor in breast cancer will be something like 3 to 5 years. But in oral cancer, it is as short as 3 months. You really don't have time on oral cancer. Is standard treatment the best option? Now pay attention to this part. One of the finest surgeons I've ever known, one of the most prominent surgeons I've ever known, and a fantastic human being. What does he say? 50% of them will die within 12 months of diagnosis. So if you consider age and the size of the tumor or stage of the tumor, then older patient with a higher stage probably less than 2 months, 3 months. So younger patients with a lesser stage 1, you can have 3 years, 4 years, 5 years. You understand what I'm trying to tell here? You understand? So why are we afraid of cancer? Why is everybody afraid of cancer? I mean, you're not afraid of minimally invasive cardiac surgery. You say, oh, very nice. Next time, if I'm going to have a heart surgery, I'm going to do minimally invasive. Not a problem. But what is the problem with cancer surgery?
Deformity.
Because the level of expertise with Dr. Saab said is at least 10 times more than of a cancer surgery. But you're not afraid of cancer, of heart surgery. But you're afraid of cancer surgery. So it's not the surgery. You don't really get what you paid for. You really don't get what you paid for. What have you paid for? You want to normal life and want to see your grandchildren grow up and have children. I'm sorry, we don't get that in cancer. Plus there is a huge amount of mutilation, very high recovery. So what have you got? You've got a treatment. You don't have what you want. You understand? Treatment is not equal to cure. Understand this point. Treatment is treatment. You understand? So depression, loss of livelihood, bankruptcy, and the danger of recurrence. That's what kills us. Cancer मतलब कि आदमी गया. Recurrence. So that if you see, what I'm going to show you here is a total shift in the thinking of cancer. So we call this a universal acceptability of failure. So it doesn't really matter whether you've done it in Hindujas or you've done it in Vedanta in Delhi or wherever. You really don't expect a result. If you get a good result, it is obviously something to be cherished. But if you don't get a good result, it's an acceptability. Am I right or am I wrong?
Yeah.
Yes. So we call this universal acceptability of failure, and this is the main feature of all parts of oncology. So recurrence. Now this is all recurrence. All big hospitals. These are results of oral cancer surgery. And it doesn't matter who has done it. It really doesn't matter who has done it. It does not matter whether the biggest surgeon has done it or the newest surgeon has done it. Because it doesn't depend on the surgeon. The problem is in the surgery. Wherever you do it, I'm sorry, there's an issue. So what causes the recurrence? Now this is something which I'm going to tell you with nobody. I don't know whether you ever actually had a lecture which said just one slide on why there is a failure of surgery. Why everybody is afraid of it. What causing the recurrence? So there are three main causes of recurrence. Apart from the fact that you've been a bad boy, after surgery you will be going back to tobacco, smoking, alcohol, whatever. Field cancer, presence of dysplastic cells in the neighborhood. You understand? What we think that what we are removing is the cancer. We are not removing the cancer, remember that. We are removing the tumor, which is approximately 95% of cancer. Therefore, we give chemotherapy and radiation. If we could remove 100%, because patients don't know that. Patients come here, no, हमको पूरा का पूरा cancer निकल जाएगा, yes, निकल जाएगा. अरे भाई साहब, then why are you giving radiotherapy and chemotherapy? Because the point is, if you tell them the truth, that we are going to remove only 95% of the cancer, 95% of the patients won't turn up for your surgery. Christmas. Now every oral cancer surgery, if everybody ever had a patient, I'm sure all of you had patients of oral cancer surgery.
Yes.
I mean, it's the most common thing. Pick up a hand who never had seen an oral cancer surgery patient. I'm sorry. So trismus causes stagnation, infection leading to development of lateral tumor. Now this is a problem with surgery, with every surgery. You're going to get trismus. Radiotherapy. Who believes in radiotherapy? Who believes in radiotherapy is the best thing that happened to humankind? You believe so, man? Okay. Radiotherapy causes change in the P53 and the tumor suppressing enzyme. Would you want to take radiotherapy, man? You want to take radiotherapy? Okay, I'll fix up an appointment at HM for you.
Some patient has a...
No, why don't you take radiotherapy? It's a very nice thing. It is supposed to stop cancer from coming out. So therefore if any of your friends has gutka problem, tell them to take radiotherapy. He won't get cancer. Does it happen that way? Why not? Because radiotherapy causes cancer. Fifth standard. You understand? Radiotherapy also kills cancer. Ultimately causes cancer. That's what the complete sentence is. Depression, huge amount of depression in these patients. Huge. Don't want to live. मेरा भी जीने का क्या फायदा है? Cigarette दोबारा चालू किया. Whatever. Doesn't make sense. So depression itself is one of the causation of cancer indirectly. This is what we meant by field cancer. So what we are seeing is this is the visible part. This is the invisible part. So we actually remove this part, and the recurrence is in this area. It's always outside the flat. Always outside the flat. Poor oral hygiene. Here I say poor oral hygiene with oral cancers. Radiation-induced cancer. Cause. You still like radiation? Very high, man. It all depends. If you have a stage 1 cancer, because the amount of field cancer is less, so you may have a radiation-induced cancer after 5 years. Stage 4 cancer will come in 3 to 4 months in 90% of the cases, and everybody knows it. Everybody knows this. So it depends on the stage. Everything is stage. Stage means size. So the whole game is on the size of the cancer. So laser surgery, what is laser surgery? No mutilation, no radiotherapy, patient friendly, more precision, less operation time, no depression, normal diet. Most of these patients are back to work in about less than a week. And there are better chances of remission and cure. Because all the three things which are major issues of surgery, induced recurrence, are not there in laser. They're just not there. So these are the results. Okay? From here to here. From here to here. From here to here. This is MRI. Now this patient is an interesting patient. He was told by everybody that no, he is not going to survive. No doctor wanted to look at him. Anyway, this is him after 2 years, 20 kg weight gain, everything going for him. खुशी मिली इतनी कि मन में ना समाए. He turned to alcohol. He had a cirrhosis of liver in 4 years. But a happy man. Extremely happy man. This patient, after 10 months, associated with the one political party, sir, वो थोड़ा दारू वारू तो चालू ही रहते थे. Because this is a negative part of laser cancer, because it becomes so easy to get out of cancer. Definitely डॉक्टर बात भी करने का. है ही कहाँ पर डरा रहे हैं? Unnecessarily that scaring us. It's not big. It's like malaria only, but it's not. All these are now more than 2 years cancer free. No cutting. No cutting. This patient is now 6 years cancer free. He was given 15 days to live because he was bleeding. He is 5 years cancer free right now. No cutting. So what about lymph node? Everybody says, what about lymph node? Lymph node नहीं कर सकते. Lymph node निकालना पड़ेगा. No, you don't have to remove the lymph nodes. You can laserize the lymph nodes under sonography control. Now, for that you have to understand the lymph node structure is like this. that we insert laser fiber inside the lymph node and we take out the central part of the lymph node and the whole lymph node necrosis. This is actually a video of it. Okay, this is a needle, this is a laser fiber, and when we laserize it, if you see this part, this basically devascularizes the whole lymph node. Okay, so all the cells in the lymph node are not given a choice, they have to die. This is something, this was actually a product of COVID times. The creativity was its maximum. If you still don't agree with this, I'm waiting outside. You can hit me with your any other question? Technical.
Any stage of cancer, any stage of cancer, oral cancer.
Sir, what we say, any stage is a very loose term because we say there is no need for you to undergo surgery at any stage in oral cancer. If you can undergo surgery, laser is your best option. If you cannot undergo surgery because the tumor is very big, at least for under 30% more cases, we can still do laser. Because I've just shown you. The last slide was where surgery was not possible. But then, sir, एक level होता है जब गाड़ी आप prepare कर सकते हो. Otherwise, it has to land up in Kurla. Shades.
Does the grade of cell makes difference?
I'm sorry, sir, I didn't get that.
Does the grade of surgery makes a difference? Stage 1, 4th grade?
Sir, I think it's more to do with the overall outcome. So if you have a grade 3 poorly differentiated, then obviously it would have a little bit of a problem. But 80% of our patients are not in poorly. They are into either well or moderately differentiated. So therefore, we can't take a 100% guarantee. Yes, sir. Okay. Now breast treatment. When we were students, we were taught about radical mastectomies, ultra radical mastectomies. Then modified radical came in our third year. And then everybody said, no, it's very nice, we don't have to cut the pectoral exposure. And by the time we graduated on 10 years, we realized that we shouldn't be doing modified radical also, we should just be doing lumpectomy for small cases. So everything changes. The only constant thing is change. You understand? So what changed for us? What changed for us was the introduction of hormonal treatments. Estrogen blocking agent, extremely good in breast cancer treatment. And introduction of effective chemotherapy. Right now that we've got a list of drugs for breast cancer. So therefore patients are not dying in 1 or 2 years, even if they got recurrences, they got seriously 5 years or whatever. The point is, why laser comes in the picture and not surgery is because most of the surgical patients, when you actually see them, they have a survival of 5 years, 10 years, but that is a progression-free survival. That means the tumor is there, it is not increasing in size because you are on treatment. You understand my point? So that is not remission, that is not cure. It's a progression-free survival. It can range anywhere from 6 months to even 2 years and 3 years. We've got progression-free survival of 4 years also. But that's because of the drugs. The tumor doesn't disappear. Understand this point. At one point, that treatment will fail. So this is actually the runaround of breast cancer surgery. You get a diagnosis, you get a surgery, you get chemotherapy, radiotherapy, then you get the excuses when they come to recurrence. We have taken out the whole tumor. I don't know why it has happened. It happened in your case only. It should not have happened. So the excuses starts coming up. Now, we are going to go into these excuses, why these excuses are important. Now, benefits of chemotherapy, basically, if you see this, is that there are certain amount of cells if you give chemotherapy, then the cells come down and then it comes recurrence. So surgery के बाद the cells come down further, you give chemotherapy, then in stage 4 they will increase. You understand this point? So this thing never touches zero. If you see, this is also the time period, 40 months, around 3 years, 5 years, death. You understand? Now, growth pattern of breast cancer is important for us. Percentage survival and the number of months. So, as long as the number of months are increasing, the percentage will keep on decreasing. And 99% of the patients will have a good growth at by around 8 years, which we said is a Gomper's curve. From 0 to 1 centimeter takes about 5 to 10 years. Now, staging of breast cancer, you shouldn't put so much of praise onto staging. Remember one thing, if there is a lymph node seen, it is stage 3. And this is just stage 3, whether it's oral cancer or breast cancer. More than one lymph node in oral cancer, stage 4, more than 5 in breast cancer, stage 4. 3B or something. And because, why it is important? In oral cancer, you can actually operate in stage 4, not an issue. But in breast cancer, it is stage 4 is metastasis, outside the thorax. These are the limitations. Post-op edema form, depression, marital problems. Size is limited to 5 centimeters, we can only operate. No effective plan B. If there is a recurrence, we really have no plan to take out drugs. We just have plans to give him more and more chemotherapy. And Bombay 5-year survival rate is only 52%. And data includes from stage 1 to 3, so therefore 3 would be much less if 52%. That means there is a lymph node there, most of the patients will not go beyond 3 years. This is the Bombay survival rate. No, and nobody is asked, all these are post-surgical cases. If it's post-surgical, you have taken out the whole cancer, everything is done properly. What is happening to the 52% or 50% patients who did not make it beyond 5 years? Why not? You said you removed all the cancer. What is the problem? Ma'am, we have already removed the cancer, no? Why the meds? PET scan, because when we did it, PET scan was negative for then what happened? I understand metastasis, but where the metastasis come from? Because these medicines coming after 4 years. There are cells who are waiting there for 4 years.
Side effect of the chemotherapy.
Side effect of chemotherapy, nowadays. Nowadays,
multicentric in origin.
Multicentric is in the local breast, sir. When you are taking out the whole breast, that multicentric part goes out.
Cells in the blood. Cells in the blood.
Cells in the blood. So metastasis, no, nobody dies from breast cancer per se. Everybody dies from metastasis of breast cancer. So the question to be raised is that if you have taken out all the cancer, why 50% of the patients are not living beyond 5 years? And the answer is this. Anyway, this is actually the National Cancer Registry program. And obviously, the above rates on the complete surgery, clear margins have been carried. Everybody's talking about clear margin. Yeah, clear margin. So what? We are going to have to the rest of the 50% patients. So what happened? This happened. Surgery itself causes metastasis. Should I read this out? Specific. Surgery induces increased shedding of cancer cells into the circulation, suppresses anti-tumor immunity, allowing the circulating cells to survive, upregulates adhesion molecules in target organs, recruits immune cells, blah 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 blah. So who is the culprit here? Surgeon. Sir, आपके सामने मैंने तो I'm a Punjabi. You may say okay, you really don't know what you're saying. These guys are not Punjabis. I don't think they are. I recognize our limitation. I recognize our limitation. surgery for cancer is the biggest problem after surgery. So it does not matter who does it. So therefore, if you actually go back to the National Cancer Registry program, Bombay may be 52%, your Tiruchirappalli may be 48%. Then it doesn't matter. It's not 95%. Understand my point? If you catch it early, like you do it in USA, yes, you got a 90% 5 years survival. But what happened to the rest of the 10%? 1 centimeter you are catching it because of your mammography program. What is happening to the rest of the 1%? Nobody wants to answer that question. The answer is there. So anytime if you have a patient of breast cancer surgery and suddenly the patient says that no, after 5 years he's got a backache and you do a PET scan and it's spread all over, and you realize it is always spread all over. It is not one time in the liver, it is not one metastasis in the kidney or in the brain, or it is all over the body and approximately everybody is 1 centimeter in size. Please go back and look at it again, because it has a common origin, and that common origin is surgery itself. In addition to tumor cells already released during the growth of tumor cells, seeding during surgery may contribute to early peak of relapse observed after removal of the primary tumor and chemotherapy. Again, sir, these are not Punjabis. Actually, the cells which are seeded during surgery actually penetrate the open vascular spaces. So there have been studies which show that the CTCs or circulating tumor cells are present in higher numbers during surgery. Yes, sir.
But if the sentinel lymph node is negative and they have decided to do a lumpectomy, instead of using a scalpel and scissor, can you use a laser to complete the
Coming on to that, sir. मैं हूँ ना sir. I am coming with the solution. I am just telling you what the problem is. Which you are not This is an exhibition by Tata Hospital itself. I don't even read this, but it says that breast, there's some stupid local anesthesia thingy, and said that they actually admitted to the fact that surgery is spreading the cancer. This is Tata Hospital report. Now, what is the advantage for laser surgery? No mutilation, percutaneous sonography guided, limited chemotherapy, no radiotherapy, and 24 hours recovery. We don't even, they are not even there for 2 days with us. And in the last 10 years, we've never had a case of shower meds. We just call it shower meds all over the body. We've not had a single case. And that is why we don't have any divorces in our patients. So these are the results of laser surgery. It's a percutaneous approach. This is before, this is after 6 months. Okay, this is a 10 centimeter tumor cell, occupying almost whole of breast. Luckily, she didn't have stage 4, but this was stage 3B, and she's still around with us with a PET scan negative, which I just showed you at 1.5 years. Okay, stage 3A. After 1 year, nothing. This is a 25-year-old girl who did not want breast cancer surgery because of marital issues. मर जाऊंगी पर मैं ये नहीं कराऊंगी. That's what exact word. Okay. I said you don't have to die. Laser है ना. You see that movie? मैं हूँ ना. This is all available on our website. So any question on breast cancer?
Same question whether the trial has been done between the use of laser in lumpectomy and scissor and
So we started that trial. We had to stop it because of ethical considerations. Because the one arm of the this was having extremely bad results at 1 year. and the other one was absolutely okay 1 year because we've done this. See, you remember, what is a trial? Trial is A versus B versus C. If A versus B, so what happens is if A versus B results are known, A is better than B or B is better than A. So these results are already, B results already are there with us. We just have to know whether the tumor is not seen at the end of 1 year on PET scan. Answer is yes or no. The metastasis which we found was a side effect. That we didn't find the metastasis after 2 years, which we generally would. The question here is whether it is a change in the management or a replacement for surgery. And once you see a PET scan negative at the end of 2 years, I'm sorry, it is a replacement for surgery. The shower mats of survival of 5 years and 10 years is a added bonus. You understand my point, sir? It's an objective diagnosis. It is not a subjective diagnosis now. Any other question?
Thank you, sir.
Okay, thank you so much. I think I tried to answer most of the questions which were in the time period. Thank you for the roses. I'll take that. Sorry, and who's the next one? You all are very nice people. So you go back and tell those people who were there next to you, you missed a great lecture.
Okay, sir. Definitely.